Health and care services support over 1.7 million people in Humber and North Yorkshire. All of the organisations offering health and social care in Humber and North Yorkshire have built a partnership to work better together. To provide the best possible services, it's important that everyone working in health and care feels valued and supported. That is why workforce wellbeing is a top priority in Humber and North Yorkshire. There are lots of free workshops, courses, coaching, counselling and other services available for anyone working in health and social care. Here are some examples.
Working with Harrogate Integrated Facilities, the opportunity arose for me to take up the role of a mental health champion that enables me to support colleagues who have problems with mental health and are looking for further guidance, and I can direct them and support them to link them in with that professional help.
While I've been a mental health champion, I've learned that mental health needs to be addressed. Just by listening to someone and being able to help them and send them to someone who might be able to help them more than I can is really important. The stigma of mental health isn't what it used to be, and people really understand it.
I attended the Accelerate program via the Humber side LMC, and it was a leadership program designed specifically for women working in primary care who are of ethnic minority background. We know that for years, women and their growth in the workplace is limited due to social structure, unconscious bias and domestic demands. By joining this program, I wanted to learn ways in which I could amplify my impact as a leader at the workplace.
The project that I took part in was Men's Health Week run by Humber Coast and Vale. The reason I took part in the project was to build on knowledge that I already had, to share issues with like-minded peers and colleagues, and also to gain an understanding of how I can help service users of our clinic. I would recommend the webinars and talks for a number of reasons. It allows you to network with like-minded peers who you might not normally speak to. You can also pick up practical tips for yourself or staff members that you may be supporting, and the presentations are of a very high quality.
As the lead for Equality, Diversity and Inclusion, I jumped at the chance to get involved in the menopause programme because it not only fitted with my objectives, it was also something I was personally experiencing and had struggled with. The menopause programme gave me access to workshops, training and an opportunity to get involved in shaping the support available for colleagues through a working group. I took part because I wanted to develop my knowledge and skills to enable me to better provide support to my colleagues. I would recommend this project because it gives you access to so much useful information, a super network of people and the chance to share your experiences.
From the mentorship program, one of the things that I learned from is the skills and tools necessary to deal with the demand on primary care, and also advice for how GPs deals with their mental health well-being. For me personally, it has opened a lot of platform for me. I've got to know other GPs within the area. I've got to know what's going on locally and also how we can support our patients as well.
Deeper Conversations isn't just about asking good questions, it's about asking great questions. And it's those great questions that lead to more meaningful conversations.
I wanted personally to take part in it to increase my tools and techniques in terms of communication, making them more effective. I think it's been a really useful and valuable course for staff to attend so they can support colleagues, but also really useful for managers as well, providing additional tools and techniques when it comes to performance appraisals or when a member of their team is going through a particularly difficult or challenging time, get to root causes and having much more meaningful conversations with them.
Hi everyone, we're here at the gym at Burlington Hospital and this is a wellbeing facility for staff. It's so good to see the gym finally up and running. It's really beneficial for staff to be physically active because it really helps with the mental well-being. I would really recommend anybody coming down and using the wellbeing facility. It's really welcoming, it's a really relaxed space that staff can come and enjoy.
I've been involved in the Institute for Leadership and Management Level 7 Executive Coaching and Mentoring Programme. What that does is that gives me the skills and knowledge and the practice that I need to be able to provide executive level coaching to people that lead in our region. I wanted to take part in this because I've always had an aspiration to provide people the skills that they need to unlock their potential.
Humber and North Yorkshire is a great place to work. These are just some of the many workforce wellbeing initiatives available for people working in health and care. Visit our website, contact us or ask your organisation's HR, occupational health or wellbeing team to see what's happening in your area.